Good morning, all. I am Dr. Vijay Alagappan, MD physician and diabetologist, practicing in Chennai. I have an experience of some around 16 years into practicing medicine. I do own a private clinic and I'm visiting consultant in certain hospitals here in Chennai. Basically, my specialization is diabetology, and MD physician, being an MD physician, I used to treat cardiac patients. So this is my brief introduction today. So to commemorate the World Heart Day, which was on September 29th. So the objective of this particular talk is to give awareness about what heart attack is, how it is happening, how can we prevent it, what are all the safety measures we can do to prevent heart attacks. On the whole, what I would like to share with you people is particularly this heart attack is on the rise normally, and particularly in this pandemic post-COVID, it is still on the higher side. So to have a better understanding, we thought like we'll give some kind of an awareness talk so that people can get rid of this heart attacks. So heart is a most essential organ of the body. It pumps the blood and circulates the blood all through the body. So if there is any kind of obstruction is happening in that circulation, definitely it can lead to some kind of irreversible complications. It can lead to heart attack, heart failures, cardiomyopathy. There are multiple terms. It can start with a chest pain called as angina, so and so. So usually the heart has to pump the blood and has to circulate all through the body. So commonly, you might have heard some in a colloquial languages saying some kind of block is there in the heart, the block percentage is so and so, and how to prevent it, how much the percentage of block is, what has to be done. So commonly the block is being happen due to thickening of the blood, fat depositions due to high blood pressure, due to high cholesterols. Commonly the block is happening due to two reasons. One is the blood density increases. Other thing is fat deposition in the blood vessels. So heart generally carries three major blood vessels. There are some branches from it. If a block happens in any of the vessels, it can lead to some kind of complications. It can lead to heart attacks. It can lead to other complications. The common complications what generally we face is heart attacks. In medical term, it's called as myocardial infarction. So at times this myocardial infarction can be irreversible. Within a short frame of time, the patient can get collapse. It's not possible, even if the patient is in the hospital, it's not possible for the intensivist or the cardiologist, whoever is over there can't do anything else. So the intensity will be such huge and high if a block is happening like that. So generally, this heart attack is happening due to the blockages, and the common cause like what we have faced, what we are learning and still will be learning in the future as well, is due to stress, due to urbanization, due to food habits, due to other factors. So a lot of things are involved. Like primarily to prevent heart attacks, like what we generally recommend is to have a proper stress management, proper eating habits, and a proper physical activity. So commonly we call as lifestyle modifications. So lifestyle modification stands on these three things. One is having a healthy diet so that we can have a healthy heart, proper physical activity, and the other factors is managing stress, and other factors apart from stress is if at all any kind of habit, something like smoking, liquor taking, all these things are there. If that can be avoided and prevented, and at one point of time if there is a requirement for us to quit, it has to be quitted. So once all these things has been properly done, definitely we can prevent heart attacks. So coming to the point of eating and healthy food is instead of going for too much of a calorified food in the forms of carbohydrates, if we can reduce the amount of carbohydrates and take more of high dietary fibers, proteins, definitely we can prevent all these things. What we commonly recommend is to have more of fruits and vegetables, poultry, fish, nuts. All these things are a healthy thing. Definitely saturated foods which contains high cholesterol is one of the major cause for heart attacks. If you can have an unsaturated fatty foods in the form of olive oil, vegetable oil, fish, nuts, fruits and vegetables, which does not contain much of saturated thing, definitely it will be a more healthy one. So if you can maintain a proper timing of food and a proper healthy food, Definitely for an individual who is weighing around 65 to 70 kg, what we generally recommend is 1600 kilocalories per day. It's basically a diabetic chart, but across all groups, this diabetic chart fits everyone. So if you can split that thing into a proper meal, out of the 1600 calories, what we recommend is to have 250 to 300 grams of carbohydrates max. The patient is not having any kind of comorbidities. Probably if with any comorbidity such as hypertension and diabetes, you have to reduce the amount of carbohydrates to 200 grams. So other than 200 grams of carbohydrates, you can have more of protein, vegetables, fruits, salads, cereals, pulses, and the other millets. All these things are more recommended. If you can maintain proper timing of food, something like the breakfast in between 9 to 9:30, lunch of 1:30 to 2, and an evening snack, as well as a dinner from 8:30 to 9, definitely it will help you in having proper healthy diet so that other complications related to acidity, hyperacidity, gastritis also won't happen. And more of if you can avoid too much of coffees, tea, all these things, definitely it will help you. If at all, if you can take fluid, good amount of fluid, in the sense like fresh juices, tender coconut, buttermilk, all these things definitely will help you in proper digestion. So what we recommend is 1600 kilocalories for a normal individuals. Depends on the BMI, we can alter the calorified food or the calorie intake, and 2.5 to 3 liters of fluid based on the patient's BMI. And the other main thing is it is always better to reduce the amount of salt. Definitely salt is a tastier one. Without salt, no food is fully being completed, but definitely salt has to be reduced at any cost. So if at all, if a patient is having a strong family history, if a person, not a patient, if a person is having a strong family history of hypertension, diabetes, and cardiovascular history of any kind of attacks or something like that, definitely they have more probability to develop all these symptoms. So above the age of 40, 45, they have to reduce the amount of salt, deeply fried oil items to be avoided. Physical activity has to be followed. So to prevent any kind of complications, any kind of chronic comorbid disease, something like hypertension and diabetes. So it's always better to maintain a healthy diet. So to have a healthy heart, once the heart is healthy, definitely all the parts of the body will be more healthy. And second thing is physical activity. So at any cost, what we generally recommend for all the individuals is to have a 30 minutes of brisk walking around 6 to 7 days a week. Probably they can have a holiday. They can maintain from around 30 minutes a day, comes to 180 minutes per week. If at all they walk for some around 6 days a week. So based on patient's other conditions, like if the patient is too young, definitely can have an aggressive cardiac exercise like jogging, cycling, swimming, can go to gym, do so. The person is more than 45 years of age having something, brisk walking is more than enough. Just have a headphone, listen to some songs, have some kind of diversion, talk with your friends, just walk around, and that is more than enough. So if you can have a good environment to walk, particularly in this pandemic, everyone was in the home due to this lockdown, all these procedures. So vitamin D deficiency was one of the cause. And apart from that, we recommend them to do the walking. They were doing it inside the home, inside the flats, the porticos, terrace, all these things. But the environment is not that good for them to have that walk. If they can do it in this pandemic with the mask, if at all the crowd is not too much, definitely they can go without mask. They can walk for some around 30 minutes a day, 6 days a week. That's more than enough. And as I mentioned earlier, if the person is healthy, they can go for cycling, jogging, other physical activities, but try to maintain it at least 5 to 6 days a week. And the other factor is managing the stress. Stress is one of the main cause for this cardiac complications and any complications per se. So if you can properly maintain the stress, properly manage the stress, manage the stress in terms of some kind of diversions, taking a break from your routine, going for some kind of outings, spending time with the people which you love to talk with them, and other parameters like listening to music, watching movies, playing games, spending time with friends and relatives. If you can do so in handling a stress, definitely you can prevent complications. And proper sleep. So if you can have a sleep of around 6 to 8 hours a day, probably 8 hours at a stretch or 6 hours in the morning, and on holidays, if you can have 2 hours nap in the lunchtime, it should be better, particularly on holidays. And now in this pandemic, more of work from home culture is being followed. So basically, they have to schedule that time, and 6 to 8 hours of sleep is more than sufficient so that you can have a fresh day, the fresh day after sleep. So if you don't have a proper sleep, the next day won't be that fresh, and it can lead to some other hindrances and obstacles. So if you can maintain a proper sleep so that the stress will also be properly managed. And the last factor is what we are talking is most of the younger generation, what we have seen nowadays is on the habit of smoking, as well as having the habit of taking liquor frequently or on and off. Definitely, smoking is one of the main cause for any kind of chronic diseases, particularly heart attacks. So, if you can prevent, if you can quit smoking, and if the person is not in a stage to quit smoking immediately, definitely what we recommend is to reduce the quantity of cigarettes, and slowly at one point of time, definitely smoking has to be quitted. And as far as alcohol is concerned, in European standards, it is 30 ml per day. It is a healthy one for the body, the entire body, as well as for the heart, something like red wine. But the 30 ml culture is not being followed in our country. So definitely, you have to reduce the intake of alcohol. And at one point of time, if the disease or the body is not accepting to have it, definitely we have to quit that. And once you can maintain all these 4 parameters, having a proper diet, having a proper physical activity, managing stress, and quitting this smoking as well as liquor, definitely will prevent you from any kind of complications. And being a World Heart Day, this is to emphasize, like, if you have a healthy heart, across all the parts of the body will be hale and healthier, so nothing will happen. Even as I mentioned in my talk, like that acidity also can be prevented. So if you can maintain all these things in a proper way, you can lead a good life. You can lead a healthy life without much of medicines, much of visit to the doctors, all these things. So it's always better to stay away from the doctors as well as from the medicines till the age progresses. Once the age progresses, there are some complications which is happening. This is also being worked out nowadays. So there are a lot of awareness videos, awareness messages, awareness camps are going on across the globe, particularly in this pandemic. So if you can hear that thing, and if you can maintain a healthy life, definitely the families, relatives, and the dependents who are all on your path will follow that. And whatever the risk we are going to face in the future related to any kind of chronic diseases definitely can be prevented. Thank you very much for hearing this message, and hope so you will follow the advice whatever was given over here. Thank you very much.